Can you just tell me about the presentation you gave today? What was the project, the piece of work you were talking about?
The project was the setting up of the community matron service, which began in 2005, and how it benefits patients in the community that have long-term conditions.
And briefly, perhaps using an example of somebody that you've helped, can you just give us an idea of how it works and how it's helped patients?
We work with people individually to try and find out what their problems are regarding health, but also social care problems and anything that affects the person's well-being, with the aim of trying to prevent unnecessary hospital admissions. We involve medication reviews, working with relatives and carers to try and prevent a crisis, recognise early warning signs of a crisis, getting in early intervention to prevent a hospital admission, and improve patient quality of life and maintain them at home where they most often want to be.
And what I took from the presentation is that the district nurses, the community nurses, basically act almost as an advocate for the person. So if they spot a problem perhaps that might involve social care or housing or something like that, you can actually get in touch and help make things happen.
Yes, it's very much about partnership working and crossing the boundaries between social care, mental health, acute services. We will stay with the person wherever they go, and we will draft in the care that they need, whether it's social care, housing problems, any issues. We work in partnership with all the services that are available, including the voluntary services, to ensure that person gets the care and support that they need.
Now, the example I remember from the presentation is a lady who, during one 3-month period, I think it was, spent 56 days in hospital, and you managed to get that down to a handful of days.
Yes, that's right. I mean, that's one of the aims, is to reduce hospital admissions. We recognise that some people need to go into hospital, and some people, because of their personality and their needs, want to be in hospital, and so they'll engineer it so that they end up in hospital. And one of the things that we can do then is to work with the hospital staff and other carers involved to try and minimise the length of stay, so that they may end up in hospital for some time but not for such a long time, whilst they're waiting for unnecessary referrals to services that are already engaged with them.
And what do you hope will happen in the future? You've had this up and running for the best part of 3 years. The initial results have been fantastic.
Yes.
Where's the next step? Where do you go next?
Ideally, we'd like to increase the service, because at the moment there's only 7 of us to cover the whole of Hastings and Rother PCT. There isn't a community matron working out in the country or the rural area at all, so we would dearly like to expand the service to have more community matrons available, because the number of people that we can actually work with is obviously quite limited. For example, I cover 16 different GPs, which is a huge workload, and I just can't manage as many people as I would like to. So to be able to increase the service would be fantastic. And maybe look at other ways of utilising our time better, by having administrative support, as support from healthcare assistants that can do some of the day-to-day basic tasks, which are part of the monitoring of the patient, but don't necessarily need to be done by the community matron. But at the moment, because of the service restrictions, we have to do it all.